So before starting this video, if you are finding this helpful in any way, try to share and subscribe and all. It will motivate me to do more videos, really. So coming to hematuria, it is of two types. One is gross and microscopic. So gross is something which you can see with the naked eye, so the urine is appearing red or the brownish color, and microscopic where you can see more than 5 RBC for eye power field, right? So I remember the causes of hematuria using this diagram. So first you draw a kidney and then you draw the small bubbles in between. So the small bubbles indicate renal stones, and in the upper part you draw a big circle, and then also in the lower part you draw a big circle. This upper circle indicates Wilms tumor and this lower circle indicates RCC, which is renal cell carcinoma. Done. And also I put some few dots here and there, so which reminds me of tuberculosis. So renal tuberculosis. So this eye indicates infraction or the infection, and this eye indicates injury. So these are the different causes of hematuria. Coming to the bladder, first you draw the bladder and you draw a big circle. This indicates bladder tumor, and you draw one worm like thing, which is Schistosomia hematobium something organism. And also you draw the prostate. This enlargement of prostate is benign prostatic hyperplasia, and very much enlargement of this prostate is carcinoma of the prostate, right? And any inflammation of this bladder causes cystitis. So these are the different causes of hematuria. Coming to the investigation, urine test which should be done in case of any hematuria, that means blood in the urine, benzidine test is done. And also you'll do this urine culture, microscopy, sensitivity and all. USG for tumors and stone, ultrasonography can be done. CT also can be done for any radiolucent stones, because usually from the x-rays you can find this radio opaque stones, but in the CT scans you can find this radiolucent stones. And urinary cytology can be done for any malignancy and study of the cells. Renal function test can be done, like urea in the blood and creatinine in the blood. IVU can be done to know the function of the kidneys. Cystourethroskopy can be done for underlying pathology. So these are different tests. The main test you have to remember is benzidine test. Again, you will write about this urine culture, microscopy and all. Ultrasound you will write. CT also you will write. And remember this biopsy or cytology kind of thing for malignancy. And IVU also you will write, because the function of the kidneys is tested by IVU, right? So these are the different investigations. Coming to the management, first read the underlying cause. If it is any infection, give them antibiotics. If it is TB, provide them anti-tuberculosis therapy. If it is stones, we'll remove the stones using lithotomy, right? Something like that. I don't remember the name. And for RCC, you'll do nephroureterectomy, right? And for glomerulonephritis, again, medical management for this is given. And for BPH, you'll do correction of BPH by medical management and also surgical management. You'll go through the urethra, TURP. There is one surgery called as TURP, right? Transurethral resection of the prostate. So you'll do that surgery. If it is any bladder tumor, you'll remove it. It can be by cystoscopic resection or chemotherapy and the radiotherapy, right? So this is about hematuria. The main important thing to remember here is the causes. So see, first draw a kidney, right? And then draw bubbles in between, which are renal stones. Draw a big bubble here, it is Wilms tumor, and draw a big bubble here, which is RCC, right? Keep small bubbles here and there, which is tuberculosis. And keep an eye here, and here also eye. This eye indicates injury, this eye indicates infraction or the infection, right? So this is about this diagram. Now coming to this diagram. So first we'll draw a bladder and we'll draw a prostate. So small enlargement of prostate is benign prostatic hyperplasia. Very much enlargement of prostate is prostatic carcinoma. And enlargement of this bladder wall is cystitis. And you will draw a big bubble here, which indicates bladder tumor. And also you will draw a worm like thing here, which is schistosomiosis hematobium. So this is about it. Bye.